turn things over to Anna Rothschild, who is a graduate of the SHRP program here at NYU and also heads the video team at 538, does a magnificent job there, and she's going to tell you more about our guests tonight. So Anna, thank you.
Thanks, Ivan. Yep, I'm Anna Rothschild. Thank you all for being here tonight. Today we're going to be talking about maternal health post-Roe in America. And joining me to do that are two wonderful guests. The first is Shefali Luthra. She is a reporter at the 19th. She covers health and the intersection of health and gender. She's also writing a book on abortion in America called After Roe. And we also have Dr. Diana Greene Foster, who is a demographer at the University of California, San Francisco, and she led the Turnaway study, which is a landmark study that was a multi-year study looking at outcomes for women who sought abortions and either received an abortion or did not receive an abortion. Thank you both so much for being here tonight.
Thank you.
So to get started, I think because it will sort of underpin this conversation to some extent, Diana, I would love if you would start by talking about the Turnaway study. What did you set out to, research, and how was the study set up?
Sure. I'm very happy to be here and happy to talk about the Turnaway study, which has, I'm sorry to say, gained a lot of relevance lately. So the study was started in around 2007. The Supreme Court was, in the case Gonzalez v. Carhart, was considering one abortion procedure and whether it was constitutional, and Justice Kennedy was the swing vote, said he thought, though there weren't any reliable data, that it was unexceptionable to conclude that women would be depressed if they got an abortion. And on that basis, he was going to ban this procedure. And the thing he got right was that there weren't reliable data, but the rest of it was really pretty far-fetched. Because many people have abortions. It's between a third and a fifth of US women have an abortion, and an unknown number of trans men and non-binary people. So but it was a talking point of people who were opposed to abortion, was that abortion hurts women. And so I really wanted to have reliable data. And how do you study the mental health consequences of abortion? Who would you compare people who have abortions to? The option is not people who've never been pregnant or people who have wanted pregnancies. It's people who want an abortion and can't get one. And so you can see how this is relevant to today's times. So this study, we recruited people from 30 abortion facilities over a 3-year period, ending up with just under 1,000 women who we followed for 5 years, calling them every 6 months. And some of them were just a little too far along in pregnancy to get their abortion. Some people were just under the gestational limit of these 30 clinics and they got their abortion. And so from a study design perspective, it was a success. The people who were just over the limit and just under the limit were very similar at baseline. And when we follow them forward, then the ways in which their lives diverge can be attributed to whether they got that abortion or not.
Great. And you looked at both mental health and also physical health, financial health. I mean, you looked at a lot of different types of outcomes for these people.
Yes, and the fastest way to summarize the results of the study is that we asked people at the very first interview what their reasons for wanting to have an abortion were. And their reasons, people who were seeking abortions, reasons for abortion, pretty much exactly describe the consequences for people who can't get one. So the leading reason is, I don't feel like I can afford to have a child, or I can't afford to have another child. And we see increases in poverty for people who are denied. They say, my relationship with the man involved in this pregnancy isn't strong enough to support a child, or he's not a great partner for a myriad of reasons. And in fact, we see those relationships dissolve whether the woman got the abortion or not. People say they want to take care of their existing children, and we see existing children fare worse. So it really makes you feel that people, when they're making this decision whether to have an abortion, are making a careful decision and they understand the consequences of their lives. And it's why it's so alarming now that some people will not be able to make that decision. They will the government is, in some states, is trying to make that decision for people.
Yeah. We talk a lot about abortion, but we don't talk a lot about the health of the person who is then going to carry this baby and give birth to this baby. What is the state of maternal health care in the US, and maybe how does it compare to other countries or other similar types of countries? Shefali.
I can take this one also. We do really badly. We are known for having some of the worst outcomes for pregnancy-related deaths compared to other wealthy nations. The outcomes are particularly bad for Black women, but in general, outcomes have gotten worse here. And one thing that we often don't talk about in the abortion discussion, at least in a larger sort of politician-driven discussion, is that pregnancy is incredibly difficult. We don't have universal health care. The act of simply giving birth is very expensive. People can take on debt as a result of giving birth. People can have their mental health suffer, their physical health suffer. Many people can die. And what we actually do know is that abortion is generally safer than giving birth. And yet, this often doesn't come up. And when we are compared to other nations, in particular by folks who oppose abortion access, the point that they raise is, well, abortion here was previously far more available than in other countries, and really, they argue, we're getting in line with other Western nations. That's just really not a disingenuous comparison to make when we look at the fact that reproductive health care at large is much more available, particularly in countries like European countries and Canada, than here.
Right. I think, Diana, you have an anecdote in your book, actually, about somebody coming up to you at an event being like, well, I'm from, was it Denmark? Yeah. I'm from Denmark, and in Denmark, we have a 12-week abortion ban, and that seems to work great for everyone. And then, well, you can.
It works really great for. I mean, I don't think it does really work great. Note it was a man who came up to me and thought it was great, but also, Europe is different because it's not as hard to cross country borders. So abortion is available to at least 24 weeks in England, to something similar in the Netherlands. And so if you're denied in one country, it's just less than if you're in the middle of Texas and you can't get an abortion. It's much harder to cross a state boundary than a country boundary in Europe. And they have, universal health care and actual income support for low-income parents. So that also changes the thing. May I add a point about physical health? I glossed over when I was trying to summarize the Turnaway study results, but in fact, it's the one area that people don't actually anticipate the full burden of carrying a pregnancy to term, is that people don't appreciate the long-term physical health risks of pregnancy, childbirth, not just immediate, but over years. So we found that women who delivered a pregnancy were much more likely to experience life-threatening complications, but we also saw worse health for them for years after. Higher chronic pain, higher hypertension, and overall lower rating of their own physical health, which is a measure associated with morbidity and mortality.
You might have said this, and I'm sorry if I'm having you repeat yourself. How many years did the study run for?
So we followed everyone for up to 5 years, but we also did clever things of like merging them to administrative data so we could look at them before they ever got pregnant, and then after whether they participated for every survey. Sometimes we were able to find their economic data. So, but at least by talking to them, we talked to them every 6 months for up to 5 years.
Great. Now that Roe has been overturned, a number of medical organizations in the United States, including the AMA, have basically said that pregnancies are more at risk because of the lack of abortions in a bunch of states. Shefali, you've written about this. Can you explain a little bit what is at risk right now?
Pregnancy is really complicated. It's one of the most intensive healthcare situations many of us will go through in our lives. If you are a physician trying to treat someone for pregnancy, you often can't prescribe them appropriate medications. If someone is miscarrying, there are concerns about whether you can give them the medications used to manage miscarriage, which are the same as used for a medication abortion. For people who require these same medications for other situations, other autoimmune conditions, for instance, there is still a question about whether you can actually access the treatment you need. One story I've been really struck by, I recently spoke with a woman from Texas, and she spoke to me about having an incredibly high-risk pregnancy, and it was a wanted pregnancy. She really hoped to keep it, but she didn't know if she could. She didn't know what her options were, and if staying pregnant would threaten her life. And her doctors were so nervous, they couldn't even provide adequate care at all because they knew that they couldn't mention abortion. She ended up keeping the child, but she had to travel to California where she could be told that she could safely stay pregnant.
I have a question about this. So we're in a really interesting moment right now post the Dobbs decision, which overturned Roe, where we have a lot of anecdotes about maternal health, but we don't have these large-scale studies. Like we don't have the results of a 5-year study yet on maternal health post Roe. And I'm wondering, as a researcher, but also as a reporter, how you kind of tell stories without like complete data, and how you kind of how you tell stories about health when you're relying on anecdotes from individual doctors, individual hospitals. Yeah.
It's really tricky. I honestly think the Turnaway study is so foundational to how I think about reporting, because it really did give us a good sense for what happens when people don't have access to abortion. And I think about that context. I think about other research that exists that shows the impact of abortion restrictions. We had a trial run in Texas when their bill banned abortions after 6 weeks. Trying to better understand how what anecdotes I see now then fit into that evidence gives me a better sort of gut check. Does this make sense? Could this fit in with what we know from previous similar situations, even though nothing is comparable? And then the other thing I do, it's not perfect, but you talk to as many people as you can, as many doctors, as many abortion providers, as many clinic administrators, and as many patients. And eventually what happens is some of the stories do sound similar, because this is sort of the first draft of having data. It's not at all equivalent, but it gives us a pretty good rough idea of what we might be expecting to see.
I don't feel like it's a mystery what's about to happen. The medical literature is completely clear that childbirth is more dangerous than abortion. Even abortion that happens in the second trimester is safer than carrying a pregnancy to term and delivering. So it's that one's not a mystery that the scientists need to solve. There's so much evidence. It's unfortunately a big burden on you as journalists, because I know that there will be more maternal deaths post-Dobbs, because more people will carry the pregnancy to term. But can I point you to the house where it's going to happen? I cannot. And so your reporting is challenging. It is going to happen, and you won't know which maternal deaths were unwanted pregnancies. And the other thing I'm very worried about from a physical health perspective is that people who don't get the word about how to safely end their own pregnancy will do things that are harmful. It happened pre-Roe, and it happened even before Dobbs. So when we did a survey of people, if alive today, have you ever in your life done anything to try and end a pregnancy? And it's more than 10% say yes, and some of them try things like herbs that may or may not be very effective. Some people try mifepristone and misoprostol, which is probably very effective. Those are medication abortion drugs. But 20% try things like hitting themselves in the abdomen and trying to insert something through their cervix. And those events are very likely happening for people who the media didn't get the message out about safe alternatives. So I'm very concerned about the burden on journalists that they try and get the scientific evidence about safe alternatives out, and then also that we actually find and report on incidents of people trying to end their pregnancies through self-harm, because I strongly suspect that it will occur. Because it's just not possible that the word has gotten out to every corner of every state, to people of all ages, of all income levels, who may not have computers, who may not read their news on the internet. This is reaching them. I don't know how you, journalists, are going to do it. But the scientific literature is clear that this kind of event is going to happen.
Right. I would love to hear what you're working on now. What sort of studies are being done, including yours, that are looking at, that are trying to quantify these effects on pregnant people?
So there are efforts to count abortions in clinics. So looking at the extent to which people circumvent their state law by traveling to another state that hasn't banned abortion. And I've heard that something like 1/4 of American women live more than 200 miles from an abortion facility now. And so I'm launching a study that I thought I was done, like turn away study, I can retire, but no. I'm launching a study to recruit the people who were the last served in their state before a ban was enforced, and the next people whose appointments were canceled or who called and were unable to get an appointment. And I'm calling it the end of row study because I'm super creative that way. And so far we have about 250 people in the study, so we're just starting. As more states ban abortion, we will add. And what I can tell you is the people who can circumvent the state law and travel out of state are people with cars. People drive 6 hours on average to get an abortion somewhere else. And what I don't know yet is what happens to people who don't have access to a car, who don't have the resources. Are they finding out about safe methods of ending a pregnancy, or are they carrying a pregnancy to term, in which case I anticipate the results of the Turnaway study to hold, of worse economic well-being, worse physical health, and attenuated life ambitions, because they realize that they're now going to be trying to take care of a kid that they weren't ready for.
We've talked a lot about physical implications of either having an abortion or carrying a baby to term. What about the mental health impact? I think both of you, I'm sure, have anecdotes about this in your reporting or in your research.
It's really hard. One of the phrases that I've been thinking about a lot is something someone said to me recently when she just talked about waiting for an appointment in another clinic in a state where abortion was legal. And clinics in some states are really backed up right now, 3 to 4 weeks, sometimes 4 to 6 weeks for an appointment. And the framing this woman used was that just, it's traumatizing to be pregnant when you don't want to be. And every day you wake up with that reminder, it's just hard to keep going. And we can talk about the really intense mental health consequences of giving birth and of being pregnant. Perinatal depression is a really undertreated problem in this country. Postpartum depression, perhaps even more so. Even if you do receive an abortion, what people are going through to get them right now is incredibly difficult, and something that I think we will see has consequences long term.
So in the Turnaway study, mental health was a focus, and we actually didn't find long-term differences in mental health between people who received an abortion, people who were denied an abortion and gave birth. And that's not because both groups were doing badly. In fact, both groups improve over time. So although I know that postpartum depression can be a major problem, it didn't emerge in this study. It didn't mean that the people who gave birth were worse off in terms of mental health. People have a range of emotional reactions to having had an abortion, from relief to regret, and people are resilient in terms of mental health. We find higher anxiety among people who are denied abortions in the short term, exactly, I think, for the reason that you're alluding to, of the ongoing search for an abortion is extremely anxiety provoking. But the truth is, serious mental health pathology is much more related to childhood abuse and other serious traumatic events, and not even an unwanted pregnancy, which can be extremely unpleasant. So that we don't find mental health differences, we find wide range of emotional responses. But remember, the context for the Turnaway study was not when it was illegal. And so I think there is a whole nother layer of stress when you are pregnant and also fearful of getting in trouble with the law. Or pregnant, having complications from something you did, and terrified of going and getting medical care. So let's just say that's a different world, and I think it needs to be studied again.
I want to talk about how we report on this as journalists in a second, but I think there's one more thing we should touch on before we get there, and that is just to sort of set the scene. Who gets abortions?
Lots of people. It's becoming increasingly concentrated among low-income people, people with low incomes, and people of color, but there are people from every economic strata and geography, religious background. The surprising facts, the things other people don't seem to know, it's not mostly teens. Half of people who get abortions are in their 20s. More than half, about 60%, are already parents. So they know what it means to be pregnant. They know, there are laws that try and mandate that people look at ultrasounds as if they don't understand what's happening inside their bodies. Well, 60% of them have already done this. So, I think there's a assumption of that people don't understand what parenting is about, and people do, because they often already are. And among the people who aren't already parenting, there's actually pretty widespread desire to have children later under better circumstances. So my biggest concern with denying people access to abortion, not my biggest is a physical health issue, but one of them is that people will have kids before they're ready, and therefore the better circumstances that they're waiting for to have kids, the more economic security, better relationship, more stable housing, all of that doesn't emerge, and so they don't get the experience of having intended kids later under better circumstances. So it's really not a pro-child decision to make people unable to access abortion services, because it's part of how people plan their families.
And then one more follow-up question on that. Who, if in the Turnaway study, who did you find were people who got turned away, who missed going early enough to the clinic to actually be able to have an abortion in their state?
Yeah, so the whole idea of the Turnaway study is to recruit people in a narrow band of time above and below the gestational limit. And so by study design, the people who got their abortions and were denied were quite similar at baseline. So it's not a great study for saying who shows up too late because or who doesn't get their abortions because we intentionally recruited people to be the same at baseline. But you might wonder, well, why would anybody show up late to get an abortion? Why wouldn't they come in as soon as possible? Well, people do come in as soon as possible, but we've made abortion access about as hard to access even before Dobbs. There were over 1,000 restrictions passed since 2011, and people, we find that when people are late in seeking abortion, it's often because they didn't realize they were pregnant. And then if you're a little bit late in seeking abortion, all of the logistical burdens, the trying to raise money to pay for an abortion, trying to find a provider who will do it, travel, all of those things become more difficult, and so the delays snowball. So just to recap, primary is that abortion is expensive, and by law, we force people to pay out of pocket for it. We've restricted public and private insurance from covering it. So money slows people down, and then there are just large swaths of the country where abortion is just not very accessible, and it slows people down to have to travel hundreds of miles.
Thanks. So abortion is a health issue, and it's also a political issue, but overall, I mean, it's a personal issue. And Shefali, I'm curious how you think about that as you're going to tell a story about maybe a law or a particular clinic or whatever it is.
I think what I have learned from covering abortion is similar to covering really any health issue, and any public health issue in particular, which is that readers don't fully grasp what a policy means or what a trend means unless there's a human story. And finding human stories is really difficult. It's difficult to do responsibly, especially in a case like abortion, where people who get abortions do face stigma. They often face threats of violence. They can face ostracization from their families. If there is a way to tell a story that incorporates someone's real lived experience and does it in a way that is respectful and safe for them, whether that means, withholding some identifying information about them so that they feel comfortable talking to me, that is always the gold standard for telling a story about abortion. This really is a human issue, and all the journalism that we can do to put faces to understand policy, it makes all the difference in the world. I think that is really what we've tried to do at the 19th in every topic we cover, but especially this one.
Great. I think we have a question from the audience, yeah.
Hi, my name's Maya. I'm a current SHRP student. Thank you both so much for coming. So one of the things I've observed, particularly in the so-called pro-life movement, I prefer to call it forced birth movement, is that they put forth a lot of arguments based on misinformation, like, for example, that abortion is being used to commit eugenics today. I'm wondering what sorts of tactics we as reporters can use to combat that sort of rhetoric.
I think it depends on how much support you get from your editors, but I simply don't print things that are not true, and that helps a lot. It sounds so obvious, but we don't need to call 6-week abortion bans heartbeat bans, and we can say, in fact, that is not a heartbeat. We don't need to use language about pain that is debunked by scientists. We can use actual scientific evidence to inform what we write, and I think that goes a long way. I do interview people and quote people who oppose abortion because they are an important political force, but if something is deliberately inflammatory and doesn't add to what their political strategy is, I don't include it because it's not helpful, it doesn't serve my readers.
Just to add, I think I saw this morning that the AP just released new guidance on abortion coverage, and you're not supposed to talk about fetal heartbeat at least the heartbeat bill at least without additional context now, given their guidelines, and similar with some of the other things you mentioned, Shefali. I'm curious how both of you see the coverage of this issue changing. What did it look like before the Dobbs decision that overturned Roe, and what does it look like now?
Yes. Okay, there's been a huge change. A colleague of mine, Katie Woodruff, wrote an article where she analyzed all the newspaper articles that mention the word abortion in a specific year, which I think it was I don't remember which year it was, but it was pre-Dobbs by a lot. And something like only 5% of the articles actually mention somebody who might want an abortion or have had an abortion. Most of them were abortion. It's a hot topic issue. It's a politicized thing. This politician votes this way on abortion. So it's just a political topic. If you were a sixth grader, you could never learn what the word meant from the article because it's just listing it as something that's controversial without explaining it. And certainly, if you just talk about it as something that's controversial and not something that somebody would need to have or want to have, it's definitely not going to further understanding about this. Everything changed with the leak, not with the decision, but in May, the newspapers went nuts, and so much of the coverage was anticipating the consequences if this leaked decision was actually implemented, and we saw a shift towards actually what are the consequences for people who can't get an abortion, and I all of a sudden became really popular with journalists, so that was a little bit fun, but mostly horrendous. And it continued. Less so as we approached the election, then there was how is this going to affect voting, which obviously is an important part of the story, but if we only talk about abortion because it's a wedge issue, people can't form an opinion or any understanding if it's so abstracted from the people who are directly affected. So there was very good coverage in May and early June of 2022 as all of a sudden people were grappling with what would it mean to end 50 years of a constitutionally protected right.
If I can add to that, I am really curious to see how attention on an abortion is sustained by a lot of news outlets that really did cover it very thoroughly right after the leak and after the Dobbs decision, and maybe may not have reporters on staff who focus on the issue specifically. Can they keep covering it in the same way that is so human focused? The other question that I do have is whether stories get placed in a prominent way. And I've definitely spoken to colleagues, to friends about sort of the challenges that a lot of journalists do face in getting front page placement or premiere placement on the website about a story that is concerning abortion. I think once we get past how many stories are written, seeing how much attention they get, whether they get that A1 treatment, is still an open question that I hope continues to shift in a way that emphasizes the issue, but I'm not entirely sure if it will.
Oh, yeah, please.
So just to say, I think the coverage will start to peter out, but prior to this Dobbs decision, the states that have governments hostile to abortion rights, people had over 300,000 abortions a year. So there's a lot. This is not something that like, oh, we've moved on and now let's talk only about inflation. This is pretty large of all of a sudden people needing to travel hundreds of miles, some people to break the law in various ways, some people to do things that are legally possibly fine but really kind of ambiguous of like, it's just not clear what the law is exactly. Sometimes the ban is on providing an abortion, but doing your own might be okay. And where are people getting information about safe abortion? It kind of has to be from the media, and the FDA has come out with guidelines, the World Health Organization has guidelines, and so part of the journalists, I would hope, is there are websites where you can go and see what the options are legally and for travel and also for doing your own abortion. I can think of two off the bat of ineedana.com or .org and Plan C pills. So both of them, I think you plug in your state and how far along you are, and you can, but you know, how is someone gonna find out about that if they're a teenager in Alabama? I don't know. So they won't find out about from me because I'm writing scientific articles that are in like peer-reviewed journals that you have to, your university library has to subscribe to. So I'm not afraid, I'm not helping particularly on that. And it really is an ongoing story that will continue to affect a lot of people. And I think it is up to journalists to disseminate information.
Sad to say that even as a professional journalist, it is sometimes hard to access things in professional journals behind a paywall.
Sorry.
Yeah. You know, as journalists, we try to report the facts based on evidence. At least as science journalists, we do. But we are also humans with our own opinions. And I'm curious, Shefali, I'm sure on every topic you cover, not just abortion, but every topic you cover, you have your own opinions on things. How do you sort of dispassionately talk about the major political issues you're trying to cover in your work?
It's a tricky balance. I do think that we do our best reporting when we understand the human stakes of what we are writing about. And that obviously makes you care. That makes you a more impassioned person. It plays into what you believe. I do my best to put my own lived experiences at the door, and every story should not be about me. It should be about the people I talk to, and it should be about readers. And I think sort of viewing that as a North Star while remembering to exert compassion to the people you are writing about, it's tough to hold both of those together, but if you can, it makes the journalism that we need. I do think that as a healthcare reporter, like, I believe that we have values that we bring to our journalism. One of my values is that things that make more people die or make people's health suffer are probably bad, and I think most editors can get on board with that. And once you have even that as like a narrow lodestar, like, that really does determine how you frame your stories and how you think about who is impacted.
You know, with any heated topic, there's going to be some level of scientific discussion about whether a particular study was done well or not, and that is just part of what research is, right? You recently, though, had an experience where a journal published basically a takedown of your work without reaching out to you. First of all, actually, I would love if you just would give a little bit of background on what happened.
Through my tears. The Turnaway study has published over 50 scientific papers in top medical, sociological, public health, econ journals. So it has gone through peer review. But not everyone loves the results that we have found. Interestingly, Ross Douthat, I don't know how to pronounce his last name, who's the Catholic columnist for the New York Times, quoted either a paper I wrote or my book, and nice long quote where I sound really thoughtful and wonderful, which is great. Like, he didn't try and make me seem like a bozo, but his point was that if I didn't find mental health harm from being denied an abortion, then it all couldn't be too bad. Like the 2 maternal deaths that we have and the increase in families living in poverty, that's not so bad because people weren't depressed. So that's a bizarre argument and a little bit not compassionate. And meanwhile, there's an institute of researchers who are opposed to abortion, and they wrote and did their own peer review on a criticism of the study. And what should have happened, I'm not at all sorry that someone's criticizing the study, that's fine, but they should have told me so that I had a chance at the same time the article came out to address the criticisms. But I didn't. I found out when it was published. I immediately wrote a explanation of why they were wrong, and then the journal sat on it for 5 or 6 months. And
in the meantime, an election happened.
And in the meantime, the author of that critique went and testified how she's written this article, and it has over 6,000 views. And I can tell you at least 1,000 are me looking to see if my damn rebuttal's up there yet. So, and also the peer review was faulty, so other people were looking at it constantly to see if it had been retracted. So it's really unfair and not how scientific journals are supposed to work. The peer review failed. The chance to actually consider the science of it failed. And I don't know, I can't remember if there was more that I was supposed to tell about this.
Oh, I don't think so. I think maybe just that the reviewers were all anti-abortion people, weren't. So it wasn't like people from all, background, all research backgrounds.
Yeah, from the same institute as the author, which is like #1 wrong thing to do in peer review.
Yeah. Ivan, I see you're standing over there. Do you have a question? Ivan, Retraction Watch wrote about this.
I was totally coincidental. I had a question and started walking over, and then you asked that question. No, there was what's known then as an expression of concern on this critique. It sounds like your rebuttal was eventually published. There's a whole sort of, there's something that when people want to bash peer review, they refer to it as pal review, right? And that's sort of what is really happening here. What's interesting is that the same sort of forces politically that like to talk about pal review of, say, climate change are the same ones who are actually engaging in it when it comes to something like this. But that actually wasn't at all my question, but thank you. I actually wanted to pick up on an earlier thread in the conversation about, and sort of ask about audience, right? And ask about sort of, so it's one thing Shefali, you were talking about, A1, sort of placement and prominent, okay, so where are these stories going to go after a while, even if people are doing them, right? And so I'm maybe taking that even a step further, and you're an outlet that, again, I agree with you, and you actually spoke to the class previous to anyone you're seeing here and talked about that notion for my class of sort of, look, there are certain things that they're not, it's not politics whether, we care whether people live or die. We should all sort of agree on that. But let's face it, the world is atomized. I think, Anna, you were saying, or maybe Diana was saying about, media are going to be a big player, but they're actually no longer the primary player. So how do you think about, either of you, how do you think about the fact that anything you write or publish or, will be sort of twisted in some way, but how do you think about reaching people who aren't already either reading you or watching you or what have you, because that to me is always this huge challenge with any story that is as sort of personal but also politically charged as something like like right to abortion. Yeah.
And this is something that we think about a lot at the 19th because we are only 2.5, maybe 3 years old. All of our audience is relatively new to us. I think that audience engagement just seems so critical in this, and the only way, I think, to really combat misinformation, to sort of regain that stature or even attempt to that newspapers, media at large once had, is to talk to your audience, to find out what people want from their news, what they feel like isn't serving them, and to find out how you can serve them. And if we sort of center conversations with our readers, whether that is through Instagram Live, through focus groups, through surveying, working with the audience team to do that, and then producing service journalism that answers their questions, that treats their concerns with dignity, I think that does go a long way. And maybe this is really optimistic, maybe, we're all completely doomed as a profession, but if we're not, then I think that is the only real avenue toward helping people sort of get information that we can ethically, responsibly, correctly provide, and that they probably won't get from listening to something like talk radio or browsing TikTok, right? But it really does involve conceiving of readers as a two-way street and thinking about how do you find, whether it's online, whether it's through focus groups, whether it's just through talking to as many people as possible, the people who aren't reading you. I think about moms as someone who are underserved by news, and how do we write about moms and reach out to moms and get my mom's friends and my friends who are moms to read us.
Do you get a lot of feedback on your work, and what does that look like?
We do, and I think our audience team is just so spectacular. They do reader surveys regularly, and they ask people, what do you want? Why, if they donate to us, why do you donate to us? What do you want to see more of? What are you not getting from your news that we can give you? They do this after events that we host. They really do after any major project. And that feedback helps us think about what are the needs that aren't being met in our journalism and in journalism at large, and how can we help fill those?
Great. I see another question over here.
Hi, my name is Kavli. I'm another current student. So this is obviously a very emotionally taxing issue, both to research and to cover. And so I wondered if either of y'all have tips about taking care of yourself so you don't get burnt out and you can keep doing this important work.
I'm totally burnt out. And speaking to the last question too, this is like way beyond what scientists usually have to do. Like usually the audience is scientific conferences, maybe a little testimony to some committee. Like I've testified before the Senate Judiciary Committee, like a little, let's inform policymakers. But to talk to journalists, I don't think many scientists are able to get any attention from journalists, so I should be happy, but it's also like nothing I was ever trained to do in graduate school. And it's really hard, and especially because of the pandemic, doing it, or my office of fellow researchers, we weren't all together, and so being alone to face this huge change in our country has been really hard, and I think it's probably just as hard on journalists, if not more difficult. We had a brief conversation before this where we were talking about, hostility we get for our work. And I actually think it's possible that I get less than the journalists who write about my work. I don't want to attract attention there, but I get fellow scientists writing me like short emails that say, your scientific design is good, and then the rest of the email is all their signature of all their different titles. They're long emails, but there's only one line that is written by them. And I think that actually journalists who cover abortion for some weird reason get more hostility. So that maybe the self-care is, I just am a little exhausted, but it's not because I feel that I'm the center of a controversy. I'm really just trying to share findings and share them in a way that people can hear them. And maybe the self-care needs to happen for the people who are at the crossfire.
I think the hardest part, the vitriol you get from people who don't like your coverage, I think transcends a lot of beats, especially when you are a woman in journalism. The hardest part for this reporting is, how many interviews can you have where someone starts crying? I wish I had a better answer for self-care than, I've been going through the old seasons of Bake Off. I have a lot of feelings about Ruby and Kim Joy's bakes, and I've truly a very supportive of editors who ensure that we take time for ourselves, make sure that we take leave if we need to, make sure that we log off on the weekends when we can. Often we can. And pick something outside of work that really allows you to spend time for you. I run a lot, and I will sign up for races and ask myself, why am I committing to run for 3 hours on a Saturday morning? Oh, it's because if I do that, I have to make time when I'm not thinking about work, and that really goes a long way.
This is a question, Shefali, that sort of transcends beats also, but we were talking about this controversy over your work before, Diana. How do you, as a journalist, know what's right? How do you report on a quote unquote controversy like this?
I think part of it is acquired expertise, but a bigger part is you have to approach reporting on anything with thoroughness and with rigor, and especially with academic studies. Whenever I have written about research, I always talk to at least one, but ideally two researchers who are not affiliated with the study, because I want someone who is involved in this area of research but disinterested to give me their take as well. There are things that you learn just from time, right? Something about what peer review should look like, what a mouse study means versus a different kind of study. What are some of the and I used to write a lot about Medicare for all and various universal health coverage schemes, and what do we know about how Medicare reimbursement works versus how Medicaid or other sorts of things work. And you just use the time you learn to keep asking as many people as possible smart questions, and just because something is published doesn't mean you have to take it for granted, at least not without doing due diligence first.
I'm also one of the current SHERP students. Earlier, you both touched a little bit on kind of the international scope of this beyond just the U.S., which I appreciated. This might be a question more for Shefali, but I'm curious to know what tips you might have for reporting on abortion in other countries that have different political and social structures than we do here, and how we can make sure we're not overlooking important contexts there and being sensitive to local circumstances. And whether there's a way to kind of frame that for a readership that will be receptive to it, here.
We talk a lot about parachuting, and the biggest thing is simply don't. Whenever I go somewhere new, usually in the US, I try and read as much as I can about them first, and I try and talk to as many people from there before I go, so that I have a sense for, even beyond my individual story, what are their big picture concerns? What are the things they think I should know about, to have a better sense for how healthcare access at large works in that community? If you are writing about I mean, there's so many countries where abortion access is so interesting, right? Like Poland, Ireland, Mexico, India are like 4 that come to mind right away. And if you can find someone who is based there, who studies these issues to help you, that's probably the best starting point, because like researchers just know so much.
So, Diana, you've written a book. Shefali, you are writing a book. They are both about abortion and outcomes for women, to one extent or another. Actually, Shefali, we haven't talked yet about what your book's about. So actually, before I ask this question, why don't you tell us what your book's about?
Sure. My book is about life after the Dobbs decision. It is trying to sort of build a more collective understanding of what it means to be either a patient or a provider in the post-Roe landscape. What does it mean if you live in a state with an abortion ban? If you live in a state without a ban, how is your access to health care still affected? And each chapter we're looking at different states that I think are really interesting, whether it's Texas or Oklahoma or California, Florida, Colorado, all have very different abortion politics, but all sort of illustrate together that the end of federal abortion rights and state level restrictions in some states affect all of us, whether we realize it or not. And so trying to get at those ideas and to think about bodily autonomy and gender equity as large, heady topics through the very granular lens of abortion rights and abortion access are sort of the underlying themes of that. I probably shouldn't say more because my editor will get mad.
Totally fine, understood. Anyway, so back to my question. I mean, this is obviously a controversial topic, also one that's in the news a lot. I'm curious, first of all, what was the experience like for both of you of finding an agent and a publisher? How did that go? Was it a hard sell? Was it an easy sell?
So I had written all those with a team of scientists, written a whole bunch of scientific papers, but very few people have subscriptions to those. And I wanted to tell the story of how this very large team of women scientists approached this topic, why it needed to be studied carefully, how we collected the data, what we found, and then so it isn't just all about us, what some of the stories from women who were in the study. So in their own words, how is it they came into the, how they had the experience of being pregnant when they didn't want to, how they tried to get care and either got it or didn't. And I knew that I didn't need to reach academics. I needed to reach people who have an appreciation for science, but don't want to read all p-values. They want to understand the results, and they want to understand the experiences. And I had I don't want to jinx myself again, but I had just the best experience trying to get published. There was some awful, I don't even remember which, in 2018, which horrible court case it was and some bad decision. And so it was a brief time when the newspapers were buzzing with abortion. And I think it was like a matter of just a couple weeks I had a proposal and an agent took it, and there was a competition for who would publish it among really great publishers, and we went with Scribner, and it was just smooth. I had an amazing editor there who was able to help make the book readable to a lay audience, and it was much easier than it should have been if it were just about me, because nobody, that it wasn't about me. It was about the science. It was about how this study answers a fundamental question about what it's like to be able to access abortion care or not in America. And so no one else had data like that, and so it was really easy and so not at all typical for people who are writing books.
Yes, Shefali, what's your
sorry.
experience?
So far the process, knock on wood, has been really quite good. I think finding an agent is very intimidating, especially when you have never written a book before. I had a friend, mentor, who had written a couple, and I asked him first, do you think do you think there is anything here, and do you think I would do a good job of it? And he was like, yes, absolutely. The only way to find agents is to be referred by someone who's worked with them already. Otherwise, it'll be really difficult. Here's my agent. Go find 2 more from your colleagues or friends and see which one you like best. I ended up going with that friend's agent. We met. We just clicked right away. I'd sent her like a 5 to 10 page sample, and she was like, this is what I want. This is great. Let's work together and build a proposal. I think it helped that I first pitched this to her after the Dobbs leak, and we signed with the editor soon after the decision came out. So timing was there. It helped that I had been covering this issue for well over a year at that point and had a body of work I could point to. I had sources I could say, I will talk to them and build them out. But really, I think this is the kind of thing that probably would have been a lot harder if I didn't have the resources and body of work and friends and colleagues to help me. And if you have all of those things, it seems so far, although the writing is not finished, so who knows, like a very achievable thing to do for any one of you if that's ever of interest.
Great. I see another question over here.
Hi, thank you for coming. So a question that's come up for me is that basically this is a very evolving subject and there's a lot changing. And I'm curious about how we can responsibly have speculation in our stories when there's such a desire for these topics to be covered and maybe the data isn't actually available yet about all of the changes that are going to happen and already happening. So I guess what is our, how do we responsibly speculate?
I was talking to someone earlier today about conveying uncertainty. And I think that's a really nuanced art, but the more we can do that, the stronger our reporting is. If I think, oh, this is a thing that might happen, but I really have no evidence, then I think that would be tricky. But I mean, as we discussed earlier, a lot of what is going to happen, we can predict with some reasonable sense of certainty. If not certainty, relatively likely to happen. And that is sort of a helpful framing to approach how we write about things that may not have happened yet. But really just the more people you talk to, the more researchers you talk to, the more clinicians you talk to, you can at very least say, this isn't a thing that is happening yet, but many people are worried it will, and here's why. I think that still has great news value.
Great. We're almost out of time, so if you guys, just fair warning, if you have any more questions, now is the time to head up to the mic. We have time for a few more questions. I'm curious, a bunch of states have already passed abortion bans, either total bans or, bans after fetal cardiac activity has been detected, pretty restrictive bans. There's some speculation to this person's last question about what might happen next legally. And I'm curious sort of what, from either what you know from your research or from your reporting, what's the next frontier of the anti-abortion movement, and what are the impacts on people's health that you think might be on the horizon? Again, conveying uncertainty here.
I just had a story about this today, basically talking to lobbyists and researchers about what can we expect to see in the coming legislative sessions. There is a lot of interest in restricting access to medication abortions. And that isn't surprising because we know that people are trying to access medication abortions through the mail, from other states, from other countries. And for folks who want to restrict access to abortion, that is a deep concern. I would not at all be surprised if we see much more attention on that in the coming year or two on the state level. And that does bring a whole host of health implications as well, because medication abortion pills are used for all sorts of things, right? They are used for miscarriages, they are used for ectopic pregnancies, et cetera, but also to what we discussed earlier, when you don't have access to a safe and effective method of ending one's pregnancy at home, that increases the likelihood that one tries unsafe methods as well. And these are, I think, really important themes for us to follow. I know there is some speculation about what the implications will be for access to Plan B and to long-acting reversible contraception. That, to me, it feels like the dust is less settled. And when I write about how are state lawmakers and abortion rights opponents going to approach contraception in particular, the thread that I am trying to follow right now is that Republicans are, frankly, very concerned because they know that access to birth control is quite popular, but they also want to satisfy a base that supports these restrictions. And the uncertainty there, I think, is perhaps the larger story rather than knowing for sure that birth control restrictions will go one way or another.
Diana, do you have anything?
Yeah, I think the whole reason I don't need self-care is I don't follow the anti-abortion movement, so I really can't help you.
Okay. There's another question from the audience.
Yeah, hi, thanks for coming. My question is about, we've talked about the importance of the human stories in covering this topic. And so when working with these people who have gone through these really hard things, whether the research angle or reporting, and like having these conversations, I'm curious about sort of how you approach these conversations gently and sort of with grace towards the person that you're speaking with, and then responsibly like covering that afterwards. So sort of, I guess, how you're actually doing these conversations and dealing with the challenges of having them.
I try to be kind, which sounds quite basic, but like I ask how people are doing. I listen. I think in like intro journalism programs, we're often taught, you know, to like not say very much and let people just sort of talk and not say yes or just say sort of like that, and I don't do that. I like if something sounds hard, I'm like, wow, that sounds really hard. How did you deal with that? I hope you're doing okay. I like have definitely spent time talking to people about their abortions, but also about their favorite video games or other interests they have, because I want them to feel like I treated them like a whole person. And then when I write about them, I try to write about them with that same level of compassion, even if I don't say, like, this is a hard thing that happened to them, to sort of use the details that I include to indicate what it felt like, which all of you are writers, you all know how to do that.
And the people who are participating in my studies don't think that they are, it's a really different thing. They think they're sharing their stories and experiences to generate knowledge, and they don't, you know, and we promise that we're giving them anonymity. And so I think there's a more of a buffer of concern about exposure that they don't have when they're talking to a journalist. Sometimes I get people who email me and say that this happened to me too, and it's only those people that I write back and say, well, would you want to share your story? I would never have someone in my own study have to share their story publicly. And we work very hard to be compassionate and open and objective and kind when we're talking to research subjects, and it's, you know, it's something that takes training to do well.
Thanks.
Hello, good evening. I'm Anthony, and I was just wondering, do you know from your reporting how much is the impact of the overturning of Roe v. Wade to the immigrants? We know that they are already at a disadvantage when it comes to healthcare access. Thank you.
I think it's really difficult for me at this stage of reporting to say X group or Y group is most affected. And we can look at history to sort of see who are the groups who are consistently more affected by lack of access to healthcare, who have been affected more by abortion bans. We know that in Texas, for instance, if you are undocumented, it is much riskier to travel out of state because of border checkpoints. We know that if you were a minor, that sometimes 6 weeks was an even more difficult to meet deadline because of parental consent or judicial bypass. But I do think that longer term, I will be really interested to see, as more data emerges, whether that supports those similar sorts of broader trends that we've seen in the past.
Yeah, so that was a great answer. And then if we're adding immigrants, minors, people with low income, people who are disabled, people who are incarcerated, people who are hospitalized, all those people are going to have much harder time traveling. And then add in anyone who has difficulty accessing information, those people are probably not going to travel and also going to not going to get information about safe methods of having an abortion outside of the medical system. So immigrants are a big group that we're looking at, and I will have to let you know.
Is there another question?
Thank you guys so much for coming. I wanted to follow up on what you were talking about earlier, Shefali, in terms of the threads that you're following going into the future. Did the election outcomes change your thought on what was going to happen in terms of the way that Republicans are going to deal with abortion and try and target different initiatives?
I think the elections affect what everyone should expect to happen in the coming years. I think it is just so striking that in every state with an abortion ballot initiative this year, voters came out in significant numbers in favor of abortion rights, or at the very least against restrictions, including in Kentucky and in Kansas. What happened in Michigan, what happened with North Carolina, Republicans not getting a supermajority, what happened in Pennsylvania with Democrats taking significant gains in the state legislature and keeping the governor's mansion. I think we know that Republicans, even after the Dobbs leak, were really hesitant to talk about the issue of abortion. They are, we know for a fact, looking at the results right now and trying to regroup how do they talk about abortion and how do they legislate on it in the coming years. But where this does get tricky as well is that the way that state houses work is, of course, that there is less sort of voter accountability because of gerrymandering, because of lower voter participation. And we also know that the anti-abortion lobby is really powerful. And so the theme that I just keep coming back to is it possible to thread the needle with what voters have very clearly rejected and with what this very powerful base interest supports? I just don't know what the answer is.
If I can add to that, actually, I know I'm the moderator, but something that I thought was really interesting coming out of this election was that it seems like voters were very savvy about knowing where their vote on abortion was going to make an actual difference in terms of law versus states like New York, for example, where a lot of politicians tried to run on abortion, but it actually wasn't like a motive. It wasn't something that really got people out to the polls. In part, I mean, you can speculate why that was, but like, you could say that it's because the laws probably weren't going to change here. So I just think that's interesting. Like, yes, people voted people voted to keep abortion protections in the states where it really mattered, but it's not like just Democrats holding up that issue anywhere in the country made it a slam dunk for them. So voters, I think, are a little more savvy than we often give people credit for. Diana, did you want to add anything about that? Nope. I think actually we are perfectly at time. Thank you both so much, Diana and Shefali, for being here. I'm so grateful to have gotten to moderate this discussion. It was amazing to learn from both of you. And thank you all for being here.
Thank you so much.
Thank you.
Thanks so much, everyone. I want to thank everyone for coming out and for hanging out with us online. I know we had a bunch of people there, and this was just such a great, powerful and important, and frankly sometimes upsetting conversation. But I want to thank our panelists so much for their contributions, and Anna, of course, for a terrific moderation and discussion. So those of you who are here, please hang out. Everyone will be here to enjoy some food and drink and more conversation. So, and I want to also thank, of course, the Kavli Foundation, who makes this long-standing conversation that has gone on for years at NYU and at Carter Journalism Institute here possible. So thanks to them as well, and good evening.